The last 2 years of the pandemic have been hard for everyone, especially the residents in Scarborough. For 42 years, the Scarborough Centre for Healthy Communities has been an organization devoted to supporting the health of the Scarborough community. We have been with you throughout the pandemic, providing access to COVID-related information, personal protective equipment, rapid antigen test kits, wraparound services in case you contract COVID, or also for post-COVID symptoms. We also provide access to vaccination through our hub clinic or our mobile vaccine team, as we know that vaccination remains the first line of defense against COVID-19. So in addition to vaccination, we hope that you will be able of walking away from this evening presentation with valuable information on how to maintain a healthy lifestyle and where to go to acquire more information and resources. So for our land acknowledgement, I am pleased to introduce you to our Director of Community Health Teams, Lynn. So when you are ready, please go ahead.
Good evening, everyone. I'm so happy to be here and join you on this great presentation. I wanted to start with the land and ancestral acknowledgements. For me personally, I try to be a part of our work in this area. And I do think about how I am situated with my own privilege and how I can contribute to the future of our work with the Indigenous and Black communities. So I would like to start by honoring the land we are on, which has been the site of human activity since time immemorial. It is the traditional territories of the Huron-Wendat, the Haudenosaunee Confederacy, the Anishinaabe, the Chippewa, and most recently the Mississaugas of the Credit River First Nations. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers are invited into this covenant in the spirit of respect, peace, and friendship. We are all treaty people. Many of us have come here as settlers, immigrants, and newcomers in this generation or generations past. We are mindful of broken covenants, and we strive to make this right with the land and with each other. I would also like to acknowledge those of you who have come here involuntarily, particularly as a result of the transatlantic slave trade. And so I honor and pay tribute to the ancestors of an African origin and descent. Thank you.
Thank you, Lynn. So now the moment that everyone has been waiting for. Today, we are excited to present Dr. Vanessa Reddit. Vanessa Reddit is a family physician at the Crossroads Clinic, a specialized primary care clinic for newly arrived refugees at Women's College Hospital in Toronto. She is also a lecturer at University of Toronto's Department of Community and Family Medicine and Dalla Lana School of Public Health. Without further ado, please help me welcome Dr. Vanessa. Dr. Vanessa, whenever you are ready, please take the floor.
I really want this to be a conversation. So please, if there are questions, raise your hand, put questions into the chat. I can't see the chat very well, but my colleagues Amy and Isabel will be monitoring and they can flag it for me. And all questions are welcomed, right? You know, COVID, the whole pandemic has been a confusing time where there's lots of new information and we're trying to process it and things are changing. So it's really normal to have questions, and it's really normal to have questions about the vaccines. And I'm really grateful that you are all taking the time tonight to join so that I can hopefully help to answer some of your questions. You may have questions that I'm not able to answer, and what I can commit to doing is trying to look for the answers. There are some questions to which we just don't have answers yet as a scientific and medical community, because we're continuing to learn about COVID, and that's kind of the way that science works. But we're going to try and work through this together. And I have to say that, you know, this is very close and dear to my heart. Much as we would like COVID to be over, it's still with us. And, you know, just within the past couple of weeks, my elderly parents got sick from COVID, and they're still recovering from it. And I have many patients who are testing positive for COVID, some who recover quickly and some who are facing long-term consequences of long COVID. So it's something that we still want to be thinking about and still being careful so that we can protect ourselves, our loved ones, and our community members. So this presentation is really going to be focusing on the COVID vaccines for young children, 6 months to up to 5 years. We're going to be talking about how the vaccines work, how effective they are, what are the side effects, what's in the vaccines, what do you do if you have allergies, about how the vaccines were produced so quickly. And then I want to leave lots of time to answer your questions at the end. So first of all, what COVID vaccine is available for children who are 6 months to 5 years of age? It is the Moderna Spikevax vaccine, okay? Children this age require 2 doses for their primary series, and these should be given at least 8 weeks apart. And they're getting a quarter of the adult dose, okay? So it's a much lower dose because children are smaller and because their immune systems are very strong and they need less of the vaccine in order to get a strong response. And that's also true of other vaccines where we give a different dose, you know, of hepatitis for children versus for adults. Just a note here that for children who are moderately or severely immunocompromised, they should get 3 doses for their primary series. Now, in this age group, they are not yet talking about boosters, but as we know, things will change. So kind of stay tuned for that. This is new. Right now, it's just 2 doses. In the future, there likely will be recommendations for boosters, but that is not yet the recommendation in this age group. However, everyone else who's 5 years and older is eligible for a booster vaccine. So how do the COVID vaccines work, including this vaccine for these young children? Well, it's the same principle as for the COVID vaccines for older children and adults, because it's the same components, and it's really the same principle as any other vaccine. So at its heart, a vaccine is teaching your body what the COVID-19 virus looks like so that you can fight off the virus if you come in contact with it in the future. So let's take a closer look at this. You probably have seen these pictures of the COVID virus. They have these little spike proteins on the outside. And the spike protein, think about it kind of like an ID badge. It sort of says, you know, I'm a COVID virus. This is how I look. So the vaccine, it has the mRNA in it is like a little instruction note. It's almost like just on a Post-it note, a little sticky note that gives instructions on how to make this spike protein. Okay, so when you get the vaccine, there are these instructions that go into your cell, and they go to, think about it like the kitchen of your cell, to make a copy of that spike protein. Then your cells show that spike protein, and your immune system says, hey, like that's not supposed to be in our body. It doesn't belong. And it starts to build up its immune system response. It builds up antibodies and other immune cells that can fight off the virus in the future. They can recognize that spike protein if you come into contact with the virus in the future. That instruction note for making the spike protein, the mRNA, your body gets rid of it, doesn't need it anymore, okay? It actually gets rid of that, its own copy of the spike protein. What remains in your body is your immune system response, that memory of what it looks like. So that in the future, when you come into contact with the virus, your immune system says, hey, intruder, I recognize that spike protein doesn't belong, and it can fight it off so that you don't become sick. A lot of people are concerned about, well, does the vaccine, it has mRNA, does it affect my genetic material? Does it affect my DNA? And this is just a simplified version of how DNA and mRNA work. And this is just a reminder that the mRNA goes to the kitchen of your cell to make these proteins. It does not enter the nucleus, kind of the headquarters of the cell. It does not come into contact with your DNA. It does not affect your DNA. It does not affect your genetic material. It does not affect your ability to become pregnant or have children in the future. It does not affect a child's hormones. Again, that mRNA is very temporary and it leaves your body. And it absolutely doesn't affect your genetic material. So hopefully that's reassuring. Now, some people ask, well, can I get COVID-19 from the vaccine? And I hope that the previous explanation has shown that no, you can't, because the COVID vaccines don't contain the COVID virus. They just cause your body to make a copy of that spike protein, not the virus itself. So how effective are the COVID vaccines? So looking at these vaccines in these younger children, how effective are they against COVID-19 illness? So in the studies that were conducted that included almost 5,000 children, in those who were 6 to 23 months old, it was shown to be about 50% effective in protecting against COVID-19 illness. So having any symptom of COVID at all. Okay, in children who were 2 to 5 years old, it was about 37% effective against COVID-19 illness. The effectiveness against getting very sick from COVID, being hospitalized, or dying from COVID is much higher. But those numbers weren't reported necessarily in the studies because there are lower rates of children actually having those severe consequences like hospitalization or death. So we can't put a number to it at this point. We probably can as we accumulate more numbers of children who get the vaccine. But all that to say, you know, these vaccines are quite effective in protecting children against getting sick from COVID-19. And another important point that's really reassuring is that these tests were done when it was the Omicron variant that was circulating. So we know that, and which is still the dominant variant that's circulating now. There are subvariants, but we know that it continues to be effective against the current Omicron variant. So what are the side effects of the COVID-19 vaccines? You know, it's very similar to the types of side effects that children would have from the other routine vaccines that you go and see your family doctor, your nurse practitioner, your pediatrician for. So most commonly, it's a little bit of swelling, maybe some pain, maybe some discomfort in their arm, maybe feeling kind of irritable, crying a little bit more, achy muscles, maybe feeling some tummy upset or loss of appetite, feeling tired, maybe a little bit of headache, sometimes a little bit of fever, but these all get better in 1 to 3 days. And you can give acetaminophen, which is Tylenol, or children's ibuprofen, which is Advil, as you normally would. Whatever you normally give for vaccines, it's okay to give that after the COVID vaccine if your child is having these symptoms. But again, it's really routine. The same types of things as your kids might have when they go to get their measles, mumps, rubella vaccine, for example, or their tetanus vaccine. So not dangerous. Of note, there have not been any cases of children getting what's called myocarditis, inflammation of the heart, or pericarditis, inflammation of the lining around the heart in this age group from getting the COVID vaccine. Okay, they are at risk for getting those complications though if they get sick from COVID. So something to keep in mind. So, why get the COVID-19 vaccine? Why should your child get the COVID-19 vaccine? Well, there are many benefits of the COVID-19 vaccine. Number one, it protects your child from getting sick. Most children, they don't get very sick from COVID, but some children do. And there is a risk of something that we call multi-system inflammatory syndrome, MIS-C, which is a rare but serious complication, even among healthy children. And sometimes it can be really unpredictable that why one child gets this and another doesn't. We don't have a good explanation. So it's not just that immunocompromised children can get sick from COVID-19. Some healthy children are getting very sick. They're ending up in hospital. So, it benefits your child, protects them from getting sick. It also lowers the risk of transmitting the virus to other people. You don't want maybe you live with elderly grandparents. You don't want them to become sick. You also don't want your neighbors or community members to become sick. So it lowers the amount of virus that's just circulating in the community, keeps our community safer, allows kids to continue going to school, going to daycare, participating in activities, and the vaccine is very safe. So why vaccinate your child if they've already had COVID infection? So the rationale for that is that COVID vaccines provide better protection than just getting sick. What we know is that many people are getting COVID-19 more than once. So even if your child got COVID, 10 months ago, it doesn't mean that they're protected now. They could get COVID again. And every time that you get COVID, it's unpredictable how sick you'll get from it. So maybe you weren't really sick the first time, but you could get pretty sick the second time. So vaccination following infection provides stronger and longer lasting protection. And this is particularly important given the school year. We want to keep kids in school. We want to keep schools open. And also because of the upcoming respiratory virus season. So, you want your kids to get the flu vaccine and the COVID vaccine to protect them and protect other people around you. It is recommended, however, if your child or yourself have had COVID infection, to wait at least 8 weeks after having the infection before you get the vaccine. And it's not that it's dangerous to get it sooner, it's that you don't need it necessarily sooner, and that you kind of get longer lasting protection by waiting those 8 weeks. So why isn't one dose enough? Why do we need to get 2 doses? Many vaccines require more than 1 dose. The first dose helps to teach your immune system what the virus looks like, as I showed in the previous slide. And then the second dose is kind of like a reminder. It helps to prime your immune system to make it ready and strong. So the second dose, you go through the same process and your immune system already recognizes it, but it kind of gives it that reminder, that boost, so that you can get an even stronger response when or if you come into contact with the COVID vaccine in the future. And just a reminder that I'm going to pull up, if I can find my vaccine note here. When your children go for their childhood vaccines, you'll remember that they have to get multiple vaccines of their tetanus, diphtheria, pertussis, polio, Haemophilus vaccine. They get it, as you can see, 5 times over their childhood. They're getting it many times over the first year of their life. Their measles, mumps, rubella, they get it twice. Their chicken pox, they get it twice. So it's not unusual that we need more than 1 dose of a vaccine in order to get full protection. So it's the same for COVID vaccines. Can children, speaking of getting lots of vaccines, can children receive the COVID-19 vaccine at the same time as another vaccine? At this point, the recommendation is to separate those vaccine visits. So to receive the COVID-19 vaccine either 14 days before or after other vaccines. Again, it's not because it's dangerous or it's ineffective. It's just that because this is a newer vaccine, we want to monitor the side effects. And if you get 2 vaccines on the same day and then you get a rash, we don't know which vaccine caused it. So for now, while they're monitoring side effects, they just want it to be separated. Most likely at some point in the future, they'll say, just as they have for adults and older children, no problem, you can do them at the same time. So a question that comes up often is, well, what about if I have a 5-year-old? Which vaccine should they get? So let's go through this. If they're 6 months to under 5 years old, then they get the Moderna Spikevax. If they are 5 years old to 11 years old, then the Pfizer pediatric vaccine is preferred. And Moderna, there's a Moderna for this age group that is an alternative. And then in the age group of 12 to 17, either the Moderna or Pfizer that's for this age group can be used. So what's in the COVID-19 vaccines? It's the same components as what's in the mRNA COVID vaccines for older children and for adults. It's just, again, it's just a smaller dose for this age group. So the medicinal ingredient is the mRNA, that little instruction sheet for making the spike protein that primes your immune system. And then there are the non-medicinal ingredients. Essentially, they're fats, salts, sugar, and water. Okay, I've given the chemical names for them here, but that's what they are. Okay. So sometimes people might be concerned about other things that are in the vaccine, but I can reassure you that, there are no food products, no nuts, no antibiotics. So, some people will ask, well, I have an allergy to penicillin. Is it okay? Or my child has an allergy to penicillin. Is it okay for them to get the vaccine? And the answer is yes, because the vaccine doesn't contain penicillin. It doesn't contain peanuts, doesn't contain milk. So even if you have allergies to those products, it's no problem because the vaccine doesn't contain them. It also doesn't contain these other chemicals that you might have heard of, thimerosal, formaldehyde. There are no fetal cells, and there certainly aren't any microchips. So what do we do if people have allergies, an allergy to peanuts, an allergy to penicillin? We often recommend that you just wait for a longer period of time, maybe even up to 30 minutes after the vaccination. And there are always medical staff, nurses and doctors and others who are on site who can deal with allergic reactions if, in that rare circumstance, it arises. So there's protection that's available and medications that are available, but not to worry. It's extremely unlikely that your child or you would have an allergic reaction to the vaccine. So another concern that people bring up is, how were the vaccines produced so quickly? And, this is really a story of international collaboration and global and political will. So, this was a pandemic. It affected the whole world, and the whole world, politicians, scientists, everyone wanted to solve this problem. So there was money flowing in to the scientific community so that they could conduct this research. And that allows things to move. Oftentimes you have to apply for funding. It can really delay things. The mRNA technology to make mRNA vaccines is not new. It's been around for decades. So they were just able to use that technology and apply it to this specific virus. I'm not sure if there's a question or maybe somebody was just unmuted. I'm going to continue, but
Please do.
in the chat or raise your hand if there was a question. Also, we were able to identify the COVID virus and its entire genetic sequence extremely early. Okay, that's where our scientific community is at, that we can do this very quickly. So then once we know what the virus is, and that was shared, then we can start developing a vaccine that targets that specific virus. In previous decades, it took a lot longer to really identify the bacteria or the virus, to develop the genetic sequence. We can now do that faster. And there was an efficient review process, right? Once the vaccine was developed, red tape that often slows things down was removed. No steps were skipped, no safety steps were skipped. It was just made more efficient, and it really was around this collaboration. So if only we could apply the same type of collaboration and will to solving other problems in our world, we would be much further ahead, and hopefully we can learn from this experience. So what do we do after receiving the vaccine? This is an important question, especially as kids are back to school, we're heading into winter, people are spending more time indoors. You still want to be careful. There's still a lot of COVID circulating. So you want to use multiple layers to protect yourself, your children, your family members, your community members. If you are sick or your child is sick, they should stay home until they're feeling better. Ideally, you still do a COVID you would still do a COVID test and isolate. You should be wearing, at the very least, wearing a mask for the full 10 days after you have COVID infection, but you really important that you stay home while you're sick and until your symptoms have improved for 24 hours. Wearing a mask is encouraged indoors. It's optional right now, but I would definitely recommend it. It's an easy way to protect yourself, to protect your kids. Washing your hands, that's just a good principle for hygiene. That helps to protect you against not just COVID, but lots of other viruses and bacteria. So these are good habits that maybe we've reinforced during COVID, and we want to carry them forward. And a question about how you can access the vaccines. So, and a really important point is that they are free. You don't have to pay any money, and that an OHIP health card is not required, okay? You don't have to be a citizen, a permanent resident, or anything. You can get the vaccine for free. And where can you get it? Well, there are a couple of different options. You can use the provincial booking site that's listed here. You can look at the Toronto Public Health website for different locations and their times, or through your local health center. And I'm sure that the team here from the Scarborough Centre for Healthy Communities can give more details about the specifics that are available at your health center. Lots of different ways. A lot of pharmacies are offering the vaccine, so there are different opportunities, and you can kind of figure out what works best for you and your family and your schedule. This has been, a brief conversation. We're going to open up in just a few minutes for question and answer, but it's very normal to have more questions. And maybe you want to talk about that specifically for your child or your family. And there are some great services that are available. So through the Hospital for Sick Kids, there is an individual confidential free phone consult that you can have with a nurse. A pediatric nurse by looking at this website link, or by request, and you can sign up online for an appointment, or you can simply email this this email address. There's also Fax is right out of the Scarborough Health Network, and it also offers individual private phone consults with a doctor that are free, and you can arrange that by calling the number that's listed here. So great opportunities for you to have a conversation so that you can have your questions answered, your concerns. It's normal to have questions, and by talking through them, often you can get the answers, the information that you need to make informed decisions. So, in summary, I just want to emphasize that the vaccines are well studied, they're safe, they're effective, including for children, young children, and that vaccines protect you, they protect your child, and they protect those around you. So, really encourage people to take in this information and to consider getting the vaccine for your young children and for yourselves as well. So I'm going to close there and open up for questions.
Thank you, Doctor, for that amazing presentation. It was very clear, a very clear language, and we thank you for that.